Good morning. Thank you for coming this morning. I am Nancy Thompson, the St. Clair County Community Mental Health Board Chair. This gathering represents a rare opportunity, key community leaders and legislatures under one roof to discuss serious threats to our public mental health system. Our goal today is to frame the conversation in real data, local experience, and a shared responsibility, and to leave you with a clear, united message from our region. I would like to extend a very gracious thank you to the Raymond group for sponsoring our breakfast this morning. Once again, thank you for being here. And at this time, I would like to say, please get up, get more coffee, get more breakfast. During the course, bathrooms are out and there's one to the left and one to the right, and enjoy yourself. And I would now like to introduce to you Deb Johnson, CEO for Community Mental Health.
Thank you, Nancy. So I also want to echo Nancy's remarks and to extend our appreciation for all of you being here. I know everybody's very busy, and we appreciate you coming for this very important topic today. And at this time, I just would like to introduce the legislators that are here, and or aides, and if you could stand up when I say your name, maybe say hi to the people, something like that. So first of all, State Senator Veronica Kleinfeld. State Senator Dan Lowers. State Representative Greg Alexander. I know Jay DeBoer is not here yet. Representative Jamie Green. Representative Joe Pavlo. I don't think I saw him either yet.
Jediah's here.
Okay. Jediah's here for Joe Pavlo. Representative Mai Shang. I don't think Jen Swift is here yet. She is planning to attend from Senator Peters' office. Mohammed Smitty, District Director for Representative Lisa McLean. Justin Huffman, Legislative Staff for Greg Alexander's office. And Philip Kraft for Representative Jay DeBoer. So I would like to also introduce the PHP and mental health leadership that are here today, at least up here in front joining me. And you could, this time, let's hold our applause until we're done just to expedite things. We have a lot of information to share with you. But first we have Richard Carpenter. He's the CFO. He comes from the Raymond Group, but he is the CFO for Region 10 PHP, Macomb PHP, and he wears other hats, but for today's purposes, that's what I'm saying. So, and also obviously his organization, his company sponsored our breakfast, which was delicious, so thank you. Will Morris, the CEO of Sanilac CMH. Brooke Sankowitz, Lapeer CEO. Tracy Smith, CEO for Macomb CMH PHP. And then Kelly Van Wormer, Region 10 CEO. Dana Lazenby, I think, is attending. I don't know if she's here yet, but she will be. And she's the Oakland County CEO. And Dan Russell, GHS CEO, and then Mark Hackle, the Macomb County Executive, is right there. So I also want to point out a list of everybody attending the event this morning can be found in the back of your agendas, just in case you forget who was here and you want to talk to somebody about this. You could do that. We also have a number of handouts today that when you checked in, you should have gotten them. Additionally, there was one that we did not have ready earlier, we didn't have it out there. It is related to legal implications. Tracy's going to reference it if she needs to, but we'll get that out. All the documents from today's event will be emailed out to anybody who put your name on that list, because you might want to use the document to send it out to somebody else. There's a lot of different options of the documents, so if that works, if you just give us your email, we'll do that. So then also, let's see what else. Well, basically, I just want to start with, it's the collective mission of all of us, the CEOs of the community mental health organizations here today, and the PHP directors, to continually provide quality, high services to the people that we serve. People with mental illness, developmental disability, substance use disorder, and the people that are in this business know that a lot of the people I'm talking about are some of the very most vulnerable, highest need people in our communities. And we need to make sure that they continue to receive the services that they need to stay on their path to recovery. Michigan's public health system, mental health system has long been a model for local collaboration. We've even been known nationally for some of the initiatives that we've done in this state, first before others. We've also been known not just for collaboration, but transparency and person-centered care. As you all know, Michigan, through the Mental Health Code, mandated person-centered care a long time ago. But now we're facing a dual threat. The threat is the proposed MDHHS competitive procurement process that could dismantle the public mental health system as we know it today. And then, of course, there's the impending federal Medicaid cuts, which would remove the financial lifeline for many of the people that we serve. So these threats would disrupt, we think, services for tens of thousands of people in our region alone. And again, that's individuals with mental illness, substance use, and developmental disabilities. So our purpose today, again, is to discuss the implications of MDHHS's proposed competitive procurement plan, the cuts, and how they jeopardize our mission. As you may or may not know, Michigan currently receives $4 billion in the state of Michigan is allocated annually for public behavioral health services. And when they first started the privatization thing, I've been around a long time, and this is the third serious go-around with this issue. But the first time, I think it was at about a $2.5 billion industry. Now it's did I say 2.5 million? Billion. And now it's $4 billion. So the recent legislation, the recent initiative could potentially reduce it by 500,000 because there will be higher administrative costs associated with private, which is going to be talked about later. So again, we also think there's an increased cost with the competitive procurement process because there would need to be, well, I'm getting too deep in the water just now, so let me hold on that. But anyways, it is a complicated process, and so that's why we want to explain it. And I also know that when I talked to Senator Lowers, I asked him what he knew about it, and at the time I called him, he had not even heard about it yet, correct? So I was concerned that none of the other legislators, and actually, Phil Kraft and I had a talk at, he is, of course, the aide to Jay DeBauer, but we talked at our recent conference about, wonder how, if Jay DeBauer doesn't know about it, Senator Lowers doesn't know about it, who else doesn't know about it? So the purpose of this gathering was to get as many legislators in the room as we could to make sure that you understood what we believe is happening. So what's being proposed, again, they're considering these changes that could jeopardize access to crucial services for the state's 300,000 Medicaid beneficiaries. And in February this past year, some of you may have seen or may not, but I think it was May 23rd, MDHHS issued a press release in which they talked about that they were going to be issuing this competitive procurement RFP process because they did a survey in February this past year. They issued it out hoping to get feedback from all the Michigan stakeholders, Medicaid beneficiaries, providers, parents, law enforcement, everybody. Well, they received a whopping 2,600 responses. So, and even if you did 2,600 responses to the 300,000, it's less than 10% response rate, but you got to count more than that because it was issued widely. Anybody could have responded to that survey. I responded to it as a parent and as CEO of Community Mental Health. So at any rate, that's not a very good response rate. And basically what they said from that is that they felt that the recurring themes were related to accessibility, satisfaction with the public behavioral health system, accessibility, the cumbersomeness of having to have an authorization or a reauthorization for services. And I don't know about any of you, but if you're private sector, there is a lot of authorizations required and pre-authorization, prior authorizations, I would say more so than in our system. So there is a significant difference between the private and the public systems already. We also, I think it's interesting to note that our state association, the Community Mental Health Association of Michigan, requested the survey results, all of the survey data and the results, and they have yet to receive it. They FOIA'd it. So they didn't just request it, they FOIA'd it. And the department said they couldn't find parts of it or something like that. So, I mean, when we get a FOIA request, we got to respond immediately. You know, there's a certain time frame. So I'm not sure why we don't have that data. So anyways, let's see what else. Oh, so that's probably enough of that. I just want to, I guess, reiterate that the public PHP system and the CMH system. The PHP has been around for over 20 years. The CMHs have been around for over 60 years, and we have successfully provided the services throughout that time. So now I'm going to turn it over to Tracy to talk a little bit more about all that.
Good morning. My name is Tracy Smith. I'm the CEO for Macomb County Community Mental Health. I'm actually going to be talking about two particular areas, but I did want to start off by saying thank you to all the Macomb individuals who are here. I will be back up here to solicit your support. So if you could hold back, and then I'll absolutely ask you to make your valuable input heard. I'm going to be talking about two areas. One, the proposal and what this means legally, as in our legal concerns. And secondly, what this directly relates to the creation of a transparent system with accountability. So let's talk about the legal implications. The MDHS, or the state of Michigan, with their current proposal, is negating the fact that they would have to go to the federal government and amend their state plan, right? So I'm going to tell you, I'm going to try to simplify some very complex things, but what I would suggest to you, if you would like to learn a little bit more, we do have a handout talking about the legal implications that anybody is welcome to have. I think if you're in the front row, you also have this handout. So again, I'm trying to simplify something, but if you want more information, we would encourage you to reference that document. So again, it's violating the federal government CMS, or Center for Medicaid and Medicare plan. Secondly, it is not valuing the current legislation known as the Mental Health Code. So legislators many years ago created a mental health code to give parameters for our system to be publicly based. In that public-based system, it values public input, it values public transparency, and it is designed around the local needs of the individuals we serve. This particular plan would negate that, or if it's simple, I had a great attorney who explained this in simple terms. Essentially, in the Michigan Mental Health Code, it says a CMHSP, Community Mental Health Program or Service Program, right? That's what you're in today. You're physically in a facility that is that organization. They are to be designed around the people they serve, and the way they define that is it's going to be decided by a county. So it's going to be a public entity that creates services for the public. So in order to be a CMHSP, you must be associated with the county. After that, in order to be a PHP, which again, the state of Michigan designed, in order to be that layer, your county and CMHSP must agree. So the state of Michigan is proposing to get rid of that. So even though the mental health code says you must be formed by a county who's a CMHSP who then designs the PHP, they're saying they're going to give it to private organizations, whether it be a large nonprofit or whether that be a large health plan. So obviously, giving it to a large nonprofit that might or might not be physically located in our state, and or might not be physically in the region we serve, we all know there's great value in the people receiving services in their community from the people who know them. And you'll hear that theme throughout our presentation of one of our concerns. So now let's move on to transparency and accountability. So you'll hear from the proposal from the state of Michigan that they're trying to create accountability and transparency. I would say to you, it does the exact opposite. Because they would give it to a private organization, whether it be a health plan or whether it be a large nonprofit, they are not accountable to FOIA, right? So the Freedom of Information Act, which means everything that we do can be seen by the public. They're also not accountable to the Open Meetings Act, right? So if you don't know this, you can come to any one of our board meetings. In fact, you can come to committee meetings and several other things. And anybody in our community has an ability to have a voice. And you'll hear throughout this that they decide what the needs are. We, of course, use data and information, but they not only have the ability to come to an open meeting and share their concerns and their feedback, but they also have the ability to participate in our advisory boards and make the services that local community serves be designed around the people we serve. The second thing is accountability. So you'll see there's a lack of accountability. This is what I will say to you. I think I had a conversation earlier a few minutes ago. We have checklists to have checklists to have checklists to have checklists in government, right? So just trust me that if anything, accountability is not an area that a public entity they have oversight, where a private entity, sometimes there are decisions, right or wrong, that are made behind closed doors. So we just wanted to highlight that this proposed change is violating federal law and state law. At the same time, it's not creating transparency and it's not creating accountability. And I'm going to pass it back to Deb, and you'll see me in a couple minutes.
Actually, she's only passing it to me to introduce Richard Carpenter, who's going to do the next portion. And like Tracy said, throughout there's a lot of themes that are going to be recurring with what we say, and we hope. But of course, we will have question and answers soon.
Good morning. And again, thank you for all of you that are willing to join us today and talk about this important issue. As you may be aware, the financial impact is important, but sometimes it's maybe the missed component. As we talk about Medicaid and the potential double threat of the two issues that we have going on, I want to start by talking about what we don't know. It's an important part to understand that whenever we talk about finances, it's some of the uncertainty or what we don't know that we don't know that's important. So I'm going to talk a little bit about the impact as we speak about that for privatization. Again, we've seen a number of 500 million potentially in 2027 that could be impacted to the behavioral health care services. Again, that's an unknown number, but it's a reasonable estimate based on what we've seen that the PIHP system currently spends in administration and what could be spent in a privatized system, again, using some federal regulations that do limit profit and or expenses in administration, but we do anticipate that could divert up to $500 million. The other one is the federal reductions in Medicaid. And again, talking about what we don't know, again, we think that could be upwards of 12.5% impact, but there's a recognition that we don't know the exact impact on the state of Michigan today. We know that there are state fiscal agencies that are trying to calculate the impact of the federal legislation right now. And unfortunately, the timing didn't work out that we do not have those answers today, but we do expect that it would be significant and it could be upwards of 12.5%. We also don't know how the state, whether at the legislative level or at the department level, is going to respond to some of those changes from the federal level. So again, at this point in time, what is the impact to the behavioral health system? We're assuming that same 12.5% would potentially flow through to the behavioral health system. So again, it could be around another 550 million. So combined between the two, by the time we get to 2028, we could be looking at over $1 billion or almost 25% of the current behavioral health funding that could be at jeopardy or at risk. So that's concerning. The question then is, what does that mean for the two regions that we're talking about today, right? We have the Macomb County region, we have the Region 10 region, which covers Genesee, St. Clair, Lapeer, and Sanilac counties. And we're concerned, though the impact could be for Region 10, 40 million in 2027 with an additional 50 million in 2028 for a total impact upwards of $90 million that we would have to determine, is that less services for everybody, less people being served? We would have to work through that process. For Macomb County, potential reductions, again, taking the same percentages, but for a slightly smaller overall budget, could be up to 33 million in 2027 and another 38 million in 2028 for over 70 million impact in the next 3 years to the people that we serve in the Macomb County area. And that's just on the Medicaid side, and that's just on the quantifiable impacts. Some of the things that people don't understand when we talk about the behavioral health system is the impact it has on other safety net or other local services that are being provided. One of our core functions from the PIHP to the CMH and then into the local community is to ensure that we're promoting jail diversion programs, other public safety partnerships with the CMHSP to try to encourage individuals to stay either out of incarceration or potentially make sure they're getting into the right level of care that they need for their particular circumstances. And so again, impacts on school supports, after school care or after school supports have an impact on children while they're in school, right? Whether they're having proper supports, impacts on health departments potentially if individuals aren't getting served through the mental health system, local emergency rooms. So there's an unquantifiable impact to other services that likely will cause or require additional dollars, either state dollars or local county dollars to make sure that the individuals in each community is getting what they need. So again, thank you for the opportunity, and I will turn it back over to Deb Johnson. Oh, to Tracy Smith.
Again, I have Executive Hackle, who will also be joining me. We're going to be specifically talking about the impacts from our perspective related to Macomb County. Then you'll see my counterparts from the other areas. So I'm going to turn it over to Mark to get his perspective and the negative impacts of this.
Thank you. And it's not often I talk about anything negative. I always like to talk positive, but the unfortunate reality is we have an issue that's come upon us that we need to be very concerned about. But I will spin it and make it more positive. And I say that for this reason. We're very fortunate. Many of you here in this room are here for a purpose and have a passion, and it's for care of others. In this particular situation, people that have mental health issues. And let's face it, there's no bigger concern other than roads that we're facing in our communities than mental health and substance use issues. And it's not just a St. Clair, Macomb, state of Michigan issue. It's a national concern. It's a national problem that we're seeing, and it's our responsibility to figure out how do we fix this and how do we deal with it. Well, I gotta take a step back in time, and I think those that are in law enforcement, Matt King, Sheriff King, who happens to be here, recognize this back in the 80s when the state decided they were going to close down mental health institutions. They decided to make it a local issue. They thought there was going to be a safety net out there to help deal with this problem, and many of us in the healthcare system, the educational systems, as well as those of us in law enforcement realized this is going to be a huge problem for us because there's no direction. We had to figure out how do we deal with this particular problem because we knew this was going to be our issue to resolve at a local level without the support of the state in dealing with people that had these problems. And so and I remember because distinctly, I happened to be a corporal at the time, heard the higher ups in the organization saying these people are going to be institutionalized now in county jails. And that's exactly what happened. And we weren't prepared to manage it. We weren't prepared to handle it. And so I really didn't have a lot of connectivity with the mental health organizations in the county. You're just law enforcement out there trying to figure out how do you deal with people, but yet many of the people you came in contact with, you knew needed some help. They needed some mental health support. They needed support in issues dealing with maybe substance use, but you didn't know who to turn to. But over time, it evolved, and the evolution was the support we had and the connectivity directly with the mental health institutions and organizations in Macomb County, in particular, Macomb County Community Mental Health. Now, there were challenges along the way, and I think, Nick and Donna, you can attest to that. And, we realized that we needed to figure out how do we support the public, but how that happened was direct communication from the public in organizations, healthcare institutions, school institutions, law enforcement came together to talk to folks, and we got to know each other. We got to know each other directly and understood the issues that we needed to support locally. So when you think about this idea of privatizing, which should otherwise be localized and was localized, I have a real challenge with that because the question becomes, who are these folks that we're going to have those direct relationships with? If I have a problem or an issue, I can reach out directly to Tracy or many of the people that I've come to know working with community mental health and have those contacts. And, that community-based support we have is there. It's been established. And now for no reason that has been given to us other than somebody saying that this is a mandate coming from the federal government, which no one's been able to show that is factually correct. It's something that's happened on an administrative level at the state. And we all need to come together to ask questions. Okay, show us where the proof is that this is something being mandated. Otherwise, explain to us why this is a better option. Why you think this direction we're heading in is going to make more sense. Now, I understand the dollars and cents side of this, but I want to set it back to, the dollar and cents to me isn't the big issue here. It's that direct relationship we have, and we're on the cusp of doing something incredibly different, transformative in Macomb County. And that happens to be with our intake and assessment center with the county jail. Now, many of you already heard about that project. We are now going to be bringing a facility into the county, adding more bed space, but the right type of beds. It's more than just a jail. It's a facility now that's going to be managing the care of the folks that come in contact with us, and the judges say are remanded to the custody of the sheriff. While they're there, we have the treatment facilities that are going to manage these people that are in there because they are a danger to themselves or others. And if we need to do the handoff, we have the community-based support partnerships that we understand are going to be able to manage and handle that because of those direct relationships we have. 24/7, 365 days a year in Macomb County, somebody gets arrested, they're coming directly to the county jail. There's no longer these separate individual cells that other local lockups may have. They're coming to us. And they're coming to us because we know we have a partnership and we're going to be working with, and we're continuing to work with right now before the building is even established. We are working with these partnerships and these organizations to figure out what can we do to manage the care of these people in there, because that's not what corrections officers do. These are special people with specialties. They went to school for this. They're educated in this. They've got experience in this. They're the ones that are assisting us inside the jail and dealing with the people that we're coming in contact with. I'm so excited about this program, this partnership, but this is going to create a huge void, a huge problem, because the question becomes, who am I dealing with now? Am I dealing with a corporation that is now going to be telling a county or a government entity how they can and cannot assist, how the funding is going to relate? And it's going to be more specific about funding than it is about treating or dealing with the person that we have contact with, that we understand needs that support and that help. We're fortunate what we have right now. We've come a long way in dealing with some of the challenges we've had statewide, but now the state is throwing a challenge at us right now that I don't see as beneficial to the people that we're out there trying to treat and trying to manage. And as was mentioned, and Rich, I got to give you credit. You talked about that. This is more than just the money. It's about, the connectivity and the problems that we're seeing in our educational systems as well. And the partnerships they're having with community mental health, our health department, and the partnerships we're having with community mental health have been incredibly beneficial. And to take that away without true understanding as to why this is happening has been somewhat of a concern for me and many folks that are within this field. And that's why we're here today, is to get the help from the legislators to ask those questions and say, why are we doing this? What is happening? It's more of an administrative rule. It's a more administrative direction taken on by the state. It's not a Republican Democrat thing. We're not here to attack somebody based upon that. It's based upon what is truly needed and what is truly necessary. And where we're headed right now, I think has been the right direction. But what's about to happen, I think, is going to set us back significantly. And it's all about money, as opposed to really addressing an issue within our communities. So, Tracy, I know that was more than what you anticipated me to speak about, talk about. But with that being said, we've got great connectivity with our Board of Commissioners, who is a legislative body that gets it. I think they're all on the same page with this. It doesn't matter. The R&D, Phil Kraft, is leading that charge. He has been connected with community mental health for some time. He's not just here as a representative of another state representative. He's here as a representative of Macomb County. And we're very fortunate and thankful that all hands are on deck in Macomb County. We're heading in the right direction. And even our corporation counsel, as was mentioned, Drew, he happens to be here. This guy truly understands this and is helping give us direction. If and when this goes in a wrong direction, how do we deal with it from a legal perspective? And that's something I would rather avoid. I'd rather try to figure out, how do we get ahead of this, make sure that we're doing the right things at the state level that impact the locals, so we don't have to get tied up in litigation. But make no mistake about it, if it's going to be necessary, we will at some point in time have to move, or it will necessitate the county getting involved from a legal perspective, because the most important thing is the people that we're serving, not about the money. So with that, thank you very much, Tracy, and I'll turn it back over to you. Thank you.
I knew I should have spoke first, right? Because I've had the privilege of a few times speaking before or after Mark, and every time I'm always like, and then there's me. So I'm not quite as dynamic, but I will try to do us justice. So in Macomb County, just to give you some specific impacts, is last year we served about 18,000 people. If this is privatized, therefore, as Richard explained, the total dollar amount would instantly be reduced by about 500 million. That would then equate for Macomb County having less financial means in order to serve the individuals. If you use that as kind of a projection, that will mean that we serve about 1,600 less people, or we'd have to look at the same number of people and figure out how can we provide less services, right? There's only so much money that if an organization has, you have to make some really difficult decisions. Other things that might be negative impact, I'm sure you guys all know this, but mental health is not a silo, right? Someone who's experiencing a mental health or substance use crisis, they need a safe place to live. They need food to eat. They need to have either some type of way to sustain themselves. Currently in our system, Mark was alluding to it, but we have a ton of great partnerships, whether it be with our school district, whether it be with the Michigan Rehabilitation Services, or of course with our law enforcement. All of those programs are creative ways that are locally designed around the needs of Macomb County in this case. Those would no longer be able to be supported. Sometimes we'll also I'll give you specifics. Sometimes we'll say gap funding. So again, I need a safe place to live. I need to get to and from services. We have some very creative solutions in order to meet the needs of those individuals. Those activities, unfortunately, would no longer exist in Macomb County. Some other things that would no longer exist would be more expensive evidence-based programs. For you of all who are not in our profession, there are programs that are very well designed. Evidence-based means there's been research done, they've been validated to ensure that if you provide this service in this exact manner, it's a good solution for a person who might be experiencing a challenge. There are some of them that are very timely and costly. Well, some of those might have to go. Is that the right answer? No, but it is a reality of how our system works. The last thing I want to point out is recently we've made a lot of progress. Our system can always be better. So if you're talking to anybody outside of our system that wants change in our system, I would encourage you to send them to us because we absolutely want to make it the best for the people that we serve. That being said, one of the things that we've been creatively working on is how can we get regions who neighbor us, this would be in a great event example, to best partner, right? So I'm privileged to have a partnership with both St. Clair and the surrounding areas, but we also have a partnership with Dana from Oakland, who's here. And we've been looking at how can we streamline quality audits? How can we streamline credentialing? How can we streamline utilizing the RFP or the bidding process to make it easier for the people we serve ultimately because we made it easier for our providers? So that, of course, is moving along and making some good progress, but of course that would stop because we would no longer have that ability to design the system around the local needs of the people that we support. So I'm going to hand it off to the next one, and we greatly appreciate everyone being here. And on behalf of Macomb County Community Mental Health and Macomb County, we cannot wait to hear more from you, and we welcome any questions in the future.
Okay, so I'm back to talk about the local impact for St. Clair County. In fiscal year 24, we served just over 7,000 individuals, providing a whole range of services, including many evidence-based or promising practices, which we'll talk about again. And so our current budget right now is about $114 million. If you take 12.5% away from that, I had the number written down, but it's not here, so I can't remember exactly what the number is. It's something like 90 something million. But you could expect, just like Tracy said, we're either going to serve maybe up to 800 people less or 700 people less, or the people are going to get less services because when there's so much money that you can only do what you can do with the money that you have. So there would definitely be an impact. Again, so far, a couple of people have talked about the community benefit, but that's one of the most, I think, important things that we have through the community mental health system across the state of Michigan. We have a lot of partnerships with people in our community. I remember actually, it was just pre-COVID, actually. Matt King, our sheriff, went with us on a trip to Washington, D.C. to advocate for the CCBHC funding to continue for us. That was before the demonstration project. But they weren't going to let us reapply because SAMHSA overlapped the grant dates. Like you can't have one grant and start another one. And it was like a technicality. And so he flew there with us. We advocated, we met with people, and then we were able to apply. And of course, the next day they shut down the Senate and everything else changed and the world was kind of wild at that time. But even during that time, community mental health had to stay because during COVID, their mental health issues or substance use, they didn't go away. We still had to provide services, and we, quickly, and I know this happened across the state of Michigan, flipped over to pivoted was the favorite word during COVID, to having a lot of telehealth opportunities. And also, but here in this building, our ACT team had to come every day to work in this building. Our mobile crisis unit had to come every day to work in the building. The prescribers, I did, our leadership team, and to make sure that services continued throughout COVID. So that's just another example of what we do when we need to for the people that we serve. Again, they talked about, the evidence-based practices. Those are expensive. You're going to see in an impact video, one person talking about the treatment that he needed for PTSD. PTSD is a real problem, and a lot of a lot of veterans have PTSD along with substance use. And so we have some very specialized treatments for folks that have PTSD, and they're effective. So we would hate to see that stuff go away. And then the other thing is we do in St. Clair County, we do crisis debriefings. It's called CISM. We do it all, for anybody that calls us. There is no charge for that. So a child dies by suicide in a high school. They call us up. We go help them. Or there's a horrible car accident, and people's lives are lost, and it's so traumatic on the responders. And we can do debriefings for them, their coworkers, all those kinds of things. In fact, our main debriefers in the back, and then our other main one sitting right over there, Kathleen and Amy. But anyways, so those are services that cost money to do that, but we wouldn't be paid probably by anybody else to do that. And so we talked at a recent state directors forum that pretty much if this happens, like, so let's say Blue Cross gets the contract, which is what I think where they're trying to go with it. If they get the contract, then we're only going to be able to provide services that have a CPT code attached to it, meaning we're going to get a reimbursement. But honestly, the reimbursement is probably not going to be sufficient. So again, those are the kinds of things that are going to change in our county. And I'm going to turn it over now to Brooke.
Good morning. I'm Brooke Sienkiewicz, the director at Lapeer County Community Mental Health, and I want to take a minute and thank Deb and her staff for organizing such an event to be able to host so everybody can have a little bit more insight on what we've been dealing with for the last couple of months. So as you see here in Lapeer County in fiscal year 24, we served 3,385 individuals. In that same fiscal year, we had a budget of approximately $36 million. So the concern for the point there, the specialty services at risk. So as we're talking about these private nonprofits that could come about and have the RFA, is what experience do they have in services that we provide every single day? You've heard all these individuals up here so far talk about the crisis services, mobile crisis services within the hospital. Out of those individuals that were served in fiscal year 24 in Lapeer, 17% of those were individuals with an intellectual developmental disability in Lapeer. Again, a service that a private health plan do not have a lot of experience in. So when I'm providing services and a budget for individual to live in a specialized residential home, those are monies that are not covered by their insurance company. Those come out of our pocket that we try to distribute money for. So again, a population that's going to be largely impacted in Lapeer County if we have these changes. And to give an idea, in some of these specialized residential homes, the daily rate can go up to like $700 per day for these individuals based on the needs that they have. A lot of those funds come out of our general budget, our general funds. So as Deb had mentioned, there's no CPT code that's sometimes related to all of these services and extra expenses that we need to provide for the care of our individuals. And just kind of echoing a lot, touching on things that have already been said, is just the oversight that we have in the care that we provide. So we have a so with the concern with the oversight that comes in is just the monitoring. So right now we have an internal process at Lapeer that provides the oversight to make sure that we are providing the best quality of care based on the department needs, the requirements. We are providing the additional oversight with what's required from the mental health code, the program fidelity, and then what the requirements are in scope of the evidence-based practice. We also have that additional oversight from the PIHP to make sure that we are providing those same standards of care as well. Again, without that process, where's that additional oversight? I can confidently say in Lapeer that I am confident with my staff that we are providing services the way they are, but across the state, are we going to have the same measure of care across for our individuals? So as they say that based on the outcome of the survey was the need because individuals want more options and more service, is that going to look the same across for everybody? And then back to the community relationships, I can't echo it more, but there's so much time that is spent every single day at a CMH to explore what it is that your specific community needs. What can we do for outreach for that? What relationships do we build? So just like every other CMH that's up here, we spend a lot of our time with local courts, jails, and law enforcement, having the mental health and drug court that we have in Lapeer. It's been ongoing, building those relationships with the courts that, again, a service that would be lost with this procurement process. And again, I could go on and on with the local schools, churches, shelters, hospitals, things of that nature. The other thing that makes it unique with Lapeer CMH is that we are not our own authority, so we still are a department of the county. So therefore, there would be some removal in the oversight from the county in regards to the funding, because you would have that private nonprofit or health plan oversight in deciding those funding. And as everybody has said so far, with a negative impact, as it could be about the amount of services provided to our community, the number of individuals that would be affected, there's also potential when it comes to the workforce that we have. So you have just as many individuals, if not more, as the years go, that are going to need help. We're now saying the potential for less services options that we could provide. And it also could affect the number of workload that we have to be able to provide that service. I know every CMH that's up here have worked very, very hard to be able to get the workforce back up to where it needs to be, especially after COVID. So this is definitely something that we don't want to step back again and we spend a lot of time and money when it comes to training staff, finding staff with the appropriate credential to be able to provide those evidence-based practices that suit the specific needs of our community. So again, we're feeling that the procurement process with the decrease in potential funding as well could be a huge hindrance on our communities and people we serve. Thank you. And then here's Will Morris.
I have to raise the mic a little bit. My name is Will Morris, and I'm from Sanilac County Community Mental Health. I'm the CEO there, and I want to thank everybody for being here today. I'm going to actually take a little different tack than my slide because a lot of it's already been repeated. But one of the things I noticed wasn't mentioned earlier, through the procurement process, the new entity is not required to contract with the community mental health center for all services. That's a significant problem for all of our communities. I know where I'm at, the sheriff has my direct line, the health department, everybody else. So they call me directly when there's an issue in Sanilac County. And historically, it's always been, I'll send somebody over. And in this new world, it literally could be, well, let me run that person's insurance card, because if it's through X PHP or whatever the new entity would be called, you need to call that number. And historically, for Medicaid health plans in Sanilac County, when we've helped people call for their behavioral health services, typically we get them an appointment in Bloomfield Hills, Birmingham. And if those of you aren't familiar where Sanilac County is, it's quite a bit north of here. I always say when I go do presentations, I believe we have more cows than we do people, and it's probably a true point. So it's important to remember that folks have a really hard time getting transportation in county to Sandusky, and we literally drive everybody to their mental health appointments through the bus system. So having them to have to go through that extra hoop is going to cause a whole different issue. And as far as the community benefit, there's just a lot of things that we do in the rural community. We go to all of the summer festivals and those kinds of things to make sure our message gets out there for folks. And especially since we became a CCBHC, it's an easy message. You need help, come to us, we'll help you. This would actually change that significantly, because it would be back to a world of, can I see your insurance card, and let's call the number on the back, and maybe we can figure out who it is that's supposed to help you. That will really be a drawback for folks to want to receive services. I also wanted to share, as I said, everybody seems to have my cell phone number. But yesterday, it was kind of perfect timing. I got a text message from a local police chief who was attending his men's Bible study group yesterday morning. And the text message says, and I quote, "I don't usually hear your name spoken out loud at a Bible study, LOL." So, but he literally said, Will Morris's mental health moment in the radio got me to reach out for help and was an answer to his prayers. I believe that having a healthy spiritual life is part of a social determinant of health. That's a situation that, we don't even know. We can't even report those types of situations unless I get a text message like that. So it really does show that real personal connection and that instantaneous benefit that someone benefited from something that we're providing that we don't even know about because we're on the radio. But those are things that we probably won't be under the new system. So thank you all for coming.
Thank you, Will, and thank you, everybody. Oh, it's still on, right? Okay. Anyways, next we're going to have up Sarah Dabrowski. Her name is so hard for me to say. I don't know why. Sarah works for us, but she's going to come up and talk a little bit. And as soon as she's done, we have a video. You can come up here. We have a video presentation. And it's only 13 minutes long, and we're calling it our impact video. It is people that we serve and our family members talking about, what the system has meant to them and what they're concerned about. But Sarah, recently, and I know Lisa Bean's here for sure, one of our county commissioners, and there could be other ones that I haven't seen at the moment, but she presented at the recent county commission meeting to speak in support of them signing the resolution to oppose the bid out process. And she was super effective, and she probably might not brag about herself, but she did a fantastic job. And one of the chair of the commission came up and talked with her afterwards and said, I'm not sure how I would have voted until I heard from you. So I'm so glad that she spoke, and she's going to talk a little bit to you, and then we'll turn over to the video. So thank you again, Sarah.
Hey, good morning, everyone. My name is Sarah Dabrowski, and I'm a clinician that works here at St. Clair County Community Mental Health. As Deb introduced, I am here to ask you to join us in opposing the competitive procurement process for prepaid inpatient health plans. As you have heard and will continue to hear today, the proposed competitive procurement process will have life-threatening impacts on the individuals that we at St. Clair County Community Mental Health serve, as well as all of the other CMHs that have spoken today. In a field that is already threatened by impending Medicaid cuts, changing the funding process at this point would be detrimental to those that we serve. I'm here today asking you to support those of us on the front lines of the mental health crisis and fight for what is best for our individuals, your constituents. When I spoke at the recent commissioners meeting, some of the commissioners had expressed feelings that a resolution wouldn't mean much because of the belief that those at the top would do what they wanted to regardless of their resolution. Following my comment, minds were changed, and as Deb mentioned, and while I don't say this to boast about my recent public comment, I say this to urge you to consider what your constituents are advocating for in the same way that our commissioners did. I urge you to show the commissioners that those at the top do listen. I also encourage each of you to consider why you are here today. If you feel similarly to those commissioners that what you say or what you do may have little impact, then I must ask, why do we as people continue to try? I continue to try, and I'm here speaking to you today because I directly see the impacts that I have, that my peers and my coworkers have on our individuals. I see the impact that they have on us and how much richer my life is because of learning and holding their stories. I try because I know that by using my voice and my privilege that I can advocate for those who are still finding their voice. Last year it was found that St. Clair County Community Mental Health served over 7,000 individuals. With every individual that we serve, I also want to prompt you to consider the impact each individual has on those around them. By providing services to those 7,000 individuals in the county, we inadvertently touch the lives of their parents, their siblings, their children and their spouses, their friends and their coworkers. The services we provide to cultivate healthy minds and healthy bodies every day has an immeasurable impact on our community and in our state. By providing the services that we do, St. Clair County Community Mental Health not only works to better the community by helping make positive changes, we impact the economy by helping individuals heal to be able to better engage and be productive members of society. And we improve thousands of lives each day. We help them find the joy and the reasons to live and to thrive. So today I have shared information on what I have personally seen, those 7,000 individuals that we serve every day, the 60 that I personally serve throughout the month, and however, the impact of a competitive procurement process will be felt by the millions of Michiganders across the state. Without continued access to mental health services, lives will be lost, potential will be extinguished. So as I wrap up, I would like to ask you again, why are you here? What can you learn from today? What changes can you make? I am here today because without mental health services, I would not be standing in front of you. I personally have sat on both sides of the therapy table, and I am proof of the benefits of mental health services. I am sure that many others walking through these halls can testify the same, maybe some of you in this room. So if there is one thing I can leave you with, I hope that by seeing the diversity of individuals served in this building, you can see the potential in them that I do. I hope you can see the potential that I was able to blossom into because of the support I had from my clinicians, and I hope that you can see the devastation that adding barriers to the mental health system will have. Thank you.
I am an individual with a family member with mental illness, and I am also the president of NAMI Blue Water Area. And what NAMI is an organization really focused on providing support and advocacy for family members of individuals with mental illness, and also, works side by side with those with mental illness. And I have experienced personally a really difficult situation and have seen firsthand the difference between someone receiving treatment from the private system versus what life is like when they receive treatment from the public mental health system. So I want to share my story a little bit. My family member was receiving private mental health services for several years, had taken the same medication for close to 5 years, was on the same, depressed. It got so bad and there was never a change in her medication when she see that doctor. Eventually she became so depressed that she attempted suicide. And when she did that, obviously her mental health was at a low, but not only that, her physical health was extremely horrible to the fact that to the point that she was in a hospital for months, rehab for months. And because she lost her job at that point, she obtained Medicaid services, which allowed her to then work with the public mental health system. And the difference in how she flourished after that, she was able to recover physically thanks to Medicaid as well. But once she got back on her feet, she received individualized treatment with her providers. There was actually follow-up. She had blood work done. None of this had ever been done before in the private mental health system that she was in for years and years. So when I look at back and seeing how the public mental health system impacted her, I have to look at what she is today. Today she actually works in the public mental health system. It impacted her that much. She's giving back to the people that are in the system where she was just several years ago. She's able to see her grandkids. She's able to function normally in society. It's really a story from someone who I went to work and could not get off the couch until someone who is working and loves her job in public mental health and working every day, being a great grandma, living a full life. The difference is incredible.
With public mental health services, I feel like I was treated equally from any other person, regardless of my brand of insurance card that I handed the person at the front desk. I feel like in certain environments, the moment that you hand over that bright green Medicaid card, the attitude sometimes shifts. And I didn't feel that here.
Since receiving services at CMH, I'm able to leave the house now. My panic attacks have lessened up. I've been hospital free for 7 years now.
While I was coming to CMH, I began to find hope again. I began to find a desire to live again. I learned how to let go of the past and accept it. I learned how to forgive, not only others, but myself as well. I learned how to accept and move on. A scary thing happened. I started to hope again. I hadn't had hope in a very, very long time. And while I was coming to CMH, I found the ability to hope again, which I didn't think was ever going to happen again. And I wouldn't have been able to do that with any of that without Medicaid. A lot of veterans either can't get veteran medical services or, to be honest, do not wish to get veteran medical services. I utilized Medicaid to come to CMH and get that hope that I never thought I would find again.
My son's plan, which involves all of the services through CMH, are very specific to him. We're not denied services based on diagnosis. My son has many different diagnoses, and we have experience with like Blue Cross, like, okay, so your son qualifies for this, but not this. With Medicaid, it's much more open. There's a lot more opportunity. My case manager is very versed in everything that my son qualifies for. His life isn't easy. It hasn't been easy. And if it weren't for public health care, then it would be even more limited.
Everybody talks about how it takes a village to raise a family. And CMH is my village right now. And they are like family, and they are helping us. They're helping me so that my children can grow to be healthy, happy adults.
It's helped me basically pick myself up off of my lowest low and help me celebrate my highest high. I don't drive, and I was able to come to Clubhouse, which is provided through Medicaid insurance, and I was able to walk there every day for about 4 or 5 years, and now I have an associate's degree because of Medicaid.
Because of Medicaid, I was able to get my fight back to take back my life from anxiety, to find programs and things and services and people that actually cared, to help enough with people that go through things that I have. My physical conditions that I was diagnosed with, high anxiety, depression. Without Medicaid, I wouldn't have been able to afford any of those services. I wouldn't be able to stand here today better than I was 5, 6 years ago. Medicaid is essential to all of us.
I was able to get the treatment that I needed currently in my life with EMDR. I don't know if I had any other insurance that I would be able to have that right now, and that would have been really, really tough. So I was really, really happy for that, and I have a deep sense of gratitude that I have this opportunity to reclaim my life back the way that I want it, the way that I need it.
St. Clair County specifically is noticing a massive cinching in of the waist of who's available for services for anything, whether it be for your dentist, whether it be for your orthopedic, whether OBGYN, dwindling. And it's getting harder and harder to find people to go to for these health concerns, and it's rapidly becoming, you hear about food deserts. Do we really want to be a medical desert? Do we want to be for anyone, but especially for those of our community that want to improve on their mental health? And what that would look like if that was to be removed.
We need a service to be ahead of the curve, because it's a lot more cost effective to get somebody to work and to get somebody part of a community and to get someone passionate about recovery and passionate about living their life again. It's a lot cheaper than constantly having people go back and forth through inpatient hospitalizations.
If I didn't have Medicaid, my life would have gone downhill if I didn't have Medicaid.
If we didn't have Medicaid, I don't even know what our family would look like. At least to say, I don't think that our family would be together with how things were with my oldest son. I honestly can't even begin to think of where we would be. That's a hard one to answer.
If Medicaid wasn't around, then I wouldn't have the services that I do. I don't think it would be covered. I don't think that I would be able to go to EMDR, be able to see the therapist I'm seeing. I don't think that I would even be in this room here speaking to you. I think that I could have been in a pinch.
If Medicaid and CMH had not been for me there at that exact time, I'll be honest with you, I wouldn't be alive today.
I would just hope that before making changes that affect people's lives, maybe we go out and set eyes on the people and set eyes on the programs that would be significantly impacted by those decisions.
I lean a lot more to the conservative side of life than I do the liberal side of life, but there are basic human needs and human services that need to go on, and I think, you know, by gutting, if you will, you know, this mental health issue and all of that, I just, again, I reiterate, I think it's disastrous. We're looking at just a domino effect of things falling apart.
Aside from my individual story, I also am the facilitator for a support group for family members of individuals with mental illness, and we do that once a month. And I see the difference between private mental health care and public mental health care often. When somebody comes in and their family member has public mental health care, they usually have treatment right away. There's something like a crisis team that comes in when they're having a crisis, help them out, get them to the hospital or where they need to go. Looking at when people, quite frankly, when people walk in with a family member with private insurance, the support group lets out a sigh and knows that it's going to be a lot more difficult for them to get the care that they need. The wait to get into a psychiatrist is so high. Whereas we have the public mental health system quite literally has people coming the second that you're in crisis. They will come out to your house, get you on the phone. The difference is just night and day. There's nothing like that in the private healthcare system. So on behalf of those in my support group and also on behalf of my family, I urge you to protect the public mental health system. These are necessary services that are individualized, and those with mental illness will not get the same type of care that they're receiving with public mental health services in the private world.
I feel like we as human beings need to come together and help one another. There's a lot of people out there that are suffering. There's a lot of people out there that need someone, that need someone to pick them up. I was picked up once upon a time, and I was pulled out of my hole, and there's others that need that. And without Medicaid, there's a lot of people that are not going to get the help they need. They're not going to get the care that they need. And that for coming from someone who was there, who lived that life, who was in a hole, that's terrifying. We as human beings need to take care of one another. We need to come together.
So that's our impact video. And I just wanted to be honest, when we started it, the federal Medicaid, the Big Beautiful Bill had not passed yet. We were hoping to use it for two reasons: to try to stop that process as well as impact our state issue. Obviously, the bill passed, but the point is still real for everybody, because those people are talking about Medicaid services, which we're talking about here, that will be jeopardized. It's the management of those services. And I thought of it when Tori was talking about her situation, but I've worked here for going on 39 years. And so I know an individual who has been in the system that long, and every time our agency tried to discharge him to the private sector because he was completely stable, he would be back within months, not even 6 months, less than 6 months every time, because they weren't doing drug levels, checking the levels of his psychiatric meds, and he was on multiple meds and they didn't know how to manage them. And we used to use the word decompensate. We don't do that anymore, because in the recovery world, we just talk about not doing so well. And he was doing not well at all. And he came in, we took him back quickly, got him right in to see a psychiatrist the day he showed up at our office. And that happened like 3 times. And after the 3rd time, I said, do not discharge him again unless he wants to be discharged, because otherwise he is better served in our system. And he knows that. And so he's still in our system. And so, but he's stable. He doesn't get a lot of services, but he gets what he needs. So it is important. So I asked Mark Hackle if he wanted to come back up here with us, and we just kind of wanted to talk a little bit about what the ask is right now, the call to action. So I'm going to let you do a little bit of the ask, and then I'm going to come back in, and then we're going to facilitate question and answers.
Yeah, Deb wanted to know what I would be comfortable asking for. And first off, about Oh, I'm going to say annually about another 200 million for roads. That was from my legislative friends here. So with that being said, actually, that's my continuous ask. But you know, it's interesting, and I draw the analogy for this particular reason, and it comes to the localizing challenges that we're facing. And again, there's nothing more challenging than local roads, with the exception of mental health and substance use. And so with that being said, this should be a continued localized issue, not a privatized issue. And I think that's the big ask I have, is the realization that these folks that have been up here, you know, whether it's Will, Sarah, Tracy, or Deb, every one of them provide that service with the multitude of staff that they have and the connectivity they have with law enforcement or educational partners. I mean, and beyond, even our healthcare systems. These folks have a direct relationship. As was mentioned, you know, you got a phone call from God coming up in Sanilac County, and they're even taking care of cows up in Sanilac County. But the reality is there's a friendship, a relationship, and to try to figure out how do you help people within your community, there's that continued partnership. It's not going to happen with the privatization. Just think about what's privatized right now with your healthcare, and if you get shut down on some service that you need when you go to a hospital system, how difficult it is to try to figure out how do you contact somebody to figure out how do you get that kind of support. Well, I'm just going to say this. Those folks that were on that video, you know, those are real people. They're people within our community. They're people within our families. They're people within our educational systems. And I just got to say this from my perspective in law enforcement. You know, I've come across many of folks, and the reality is, you know, our job is to figure out how do we make their lives better if we can. How do we deal with some of their challenges? But, you know, if you don't have somebody that you had contact with, that you know, that your relationship, you yourself, a family member, doesn't have a mental health or substance use issue, you are very fortunate. Because I got to believe everyone here in this room probably knows somebody that does. And they probably could have got up there and had a testimonial as a result of some connectivity they've had with one of you, let alone somebody from community mental health. This is a localized issue, and that's what we're asking, is for the legislature. The only ask I have is check the facts. You know, whatever you're hearing from, you know, Department of Health and Human Services, you need to check with these folks. These are the subject matter experts. These are who I rely upon to get my information, to understand how do we do it better in our communities. Have since I've been in law enforcement, have since I've been the county executive and dealing with our board of commissioners. We have a fortunate relationship in Macomb, and I see just from the conversations I've heard from elsewhere here, you have great people working within your communities that know how to do it and are doing it the best way possible because of the relationship building. So my ask is get to know these folks if you don't know them, and ask them questions after you start asking questions from MDHS as to why they think this is necessary, because no one has been able to get a true or straight answer. Follow the money. Often, sometimes you hear, well, the reality is that money needs to be localized and continue to support the efforts that we're seeing here. So I will turn it back over to you, Deb.
Thank you very much. Okay, so at this point, we're going to do question and answers. If you guys have any questions that you would like to ask now, okay, we'll do that. And then we're going to pass the mic back and forth to you.
Thank you so much. Good morning, everyone. I want to, first of all, thank all of you for being here today and for putting this together. I mean, just a phenomenal job bringing everyone together, all of the 44 county CMH leaders. Appreciate all the work that you guys are doing on the ground. You know, made it clear today, but we also know just how incredibly important the work that you guys do to provide for one of the most vulnerable populations. So thank you for that so much. You know, having served as a commissioner with Commissioner Kraft as the CMH chairperson, I know how incredibly you know, critical CMHs are to serving the local communities. And I would argue Macomb is probably one of the top ones in the state of Michigan. You know, I'd be remiss though if I didn't share, you know, MDHHS's budget is 75% Medicaid, federal dollars, $27.8 billion is Medicaid out of the DHHS budget, so about 75%. So only about 8.4%, $8.4 billion is state, majority of that is federal funding. And because of this federal bill that just passed, I mean, we could lose upwards of $6 billion. 1 in 4 Michiganders on Medicaid, 3 million residents. And frankly, I'm disappointed that our congressional delegation is not here. I believe that what we're trying to solve is a problem that they've created. the state is unlikely to fill those gaps. I don't believe in privatization at all. And I hear you very loudly and clearly, whatever we can do to ensure that these dollars stay within our local community and that they are publicly managed. It's possible that because of these federal cuts, that the state may be forced to have to change the PIHP system. I'm not saying that that's the right answer at all, and certainly I haven't talked to DHHS about it, but I think there's another conversation here that, and maybe I, wanted to make sure we address the elephant in the room, because of these federal cuts, that we are forced to be here today to have these difficult conversations. And the reality is, because we are going to face so much of the Medicaid cuts from the federal government, I don't know, I don't have an answer for you today on how the state is going to just kick in more dollars, whether that's administrative dollars or to fill in those gaps. So that would be.
I hear everything that you're saying, and I agree that one of the things we know that there's going to be potentially those cuts. So doing what they're talking about doing would raise costs all over the place. It won't lower them, and it will reduce services. But do we think that there's efficiencies that could be had in the system? We sure do. And one of them is the administrative burden. We've mentioned that a couple of times. We've been trying to deal with the department for years, ever since I've been working in this field, to say, there's so many things that could be done more efficiently, but they don't listen to those things. That yet they pile on these additional requirements. They're not required by CMS. So, I mean, if they're Medicaid requirements, we understand we have to follow them. But then some of this other stuff, no. And so I think that there are definitely ways that we could create efficiencies across the state of Michigan. But I think so if that's the conversation. But I also agree with what you said about having, they're not, the people that are talking up there, they don't have the firsthand experience down here. And somebody else said if people could lay eyes on the people that we serve, that might help, because they don't understand even what we do. I don't think they don't know the people we're talking about. I think there's a question there, unless you want to add to that one.
Yes, we greatly agree, right? That's actually one of the reasons why we're saying, if you need to improve the system and make some major changes, do it when it makes sense. Don't do it when you're going to have billions of dollars less, right? Because just to remind you, if this moved to a private organization, the average cost of a PHP that Richard was mentioning is anywhere from 2 to 6%. The average cost of a private organization is anywhere from 12 to 15%. So day one, there would be $500 million less in our system as of the way they're proposing it, October 1st of 2026. So to your point, there's going to be less money, and then they're going to take the money that we have and give it to someone who costs more.
And one of the things, I know I'm probably going to get in trouble from somebody at some point, but I keep saying this, but the Blue Cross CEO salary last year was almost $14 million. And that's who they're talking about. I mean, that's a nonprofit. I mean, none of us in this room make anything close to that. And so, if the CEO makes that much money, and that was a bad year for them, and he made that, because the year before they made more. So he's retired now, because I would work 1 year there and retire too, if I could. But at any rate, those are the things. And if you look at the other private health plans, it's the same thing. But go ahead, Senator Kleinfeld.
Thank you. I want to, first of all, on number 7 on your codes here is the Public Act 121 budget appropriations. So you're talking about the statement: the department shall use the funds appropriated to support a system, comprehensive community mental health, ... Is that in the boilerplate in the actual budget? And the reason I'm asking is because there will be a new budget this year, and I'm wondering if the intent is to have that boilerplate removed. So it is under Michigan Law and Codes number 7. Do you know if that's? Okay. So I do know a little bit about this. It's a complicated system, because if I understand correctly, it's sort of like you guys are the insurance company and you're the entity that gets paid because of the PIHP, but it's complicated. It's not that simple, and I understand that. I have approached 2 people on the subject. Both of them have said the same thing, that this is not this is a mandate from the federal government. You guys have also indicated you have not been able to get any proof of that. Has anybody reached out to any members of Congress to try to get to the bottom of whether or not there is actually any indication from the federal government that our exemption is going to go away?
Well, that's a good point, but not specifically, but we do have Mohammed Smitty here representing Lisa McLean's office. Jen Swift was going to be here, but we can follow up with her representing Senator Gary Peters' office. But that's a good question that we should ask that question. And I do know, and I don't know if this is what you're sort of getting at too, some CMH, well, like Macomb is both a CMH and a PHP. We're not, but there's 3 situations like that: Macomb, Oakland, and Wayne. And then there's the rest of the state and the other regional entities. But honestly, I never thought we needed PHPs in the first place, because I wish I'd have thought of this last night when I was thinking about today. I thought I should have made the spaghetti slide, the famous spaghetti slide. People who've been in the system a long time know what that is, because MDH, they were probably DCH at the time, said, we don't want to have contracts with 46 CMH boards, Medicaid contracts, so we're going to have PHPs. Let's have 25 PHPs. So that's what we had at first. But then they had 25 Medicaid contracts and 46 GF contracts, general fund. They still have the 46 general fund. Then they said, we don't want so many contracts. So then they went to 10 PHPs. And they also said being a CMH and a PHP is a conflict of interest. And then I said, oh, everywhere. No, I love Macomb, Oakland, and Wayne counties, but it wasn't in those counties, just everywhere else. Because I was the PHP director and CMH director. So I thought that we managed it just fine. So because really all of our hearts are in the right spot. We're doing this for the right reason. We know what we're doing. So anyway.
And I reached out to Phil and hit him with the same question. He'll tell you Phil, Maya, and I all served as county commissioners together. And so we know he knows about this stuff more than we do. And then I have one more question, and I'll set the microphone down. And that is, if this is not because the federal government's going to mandate it, what's driving this?
Blue Cross. big money in the private industry.
You might get in trouble for saying things that's I get the ability to do that. With that being said, it's interesting, because when you say, checking with our federal representatives as to whether or not this has been mandated, it's very simple. I wouldn't do anything as a county executive adjusting things with my health department or anything we do unless there was something that was given to me that gave me that direction and said, you need to do this. That's the problem. We've asked the state for where is that directive you got from the federal government or the legislation that shows that there is a need to do what it is we're doing. They don't have that information. That has never been given to us. So the question becomes, then why are we doing this? That's all we're asking for, is show us in documentation where you've got this direction coming from the federal government that says, because of whatever this, the new bill or whatever it is that some people don't like, or whatever it might be, show us where that's at that says this. And we've gotten no answer. And so that to me is a problem. But I'm going to get back to the speculation as to what might be driving this. We don't have that answer either. And that goes back to the law enforcement, background. What is the real intent? Why is somebody doing what it is they're doing? Not to say it's a crime, but there's some motivation behind this. And what is that? And I don't have that answer either. But I do believe when we start talking about Blue Cross, and CEOs making lots of money, yearly incomes of 14 million or beyond, that's problematic to begin with. That's money that could be reinvested if you don't have a CEO getting paid that much into the community and people as far as providing services. So I'm not a big advocate for big pay scales for these CEOs. But the challenge becomes, if and when this does occur, those organizations are now going to need staffing. And they're going to now figure out how do they have staffing that's going to support what it is they're now taking on with this new nonprofit to deal with the medical issues and mental health and substance use that they didn't have before. Some people are going to be hired to do that. So the question becomes, is there a landing spot or are there job opportunities for folks? I don't know. I'm not saying that there is, but something's fishy, because no one's given us an understanding and no one's given us the true meaning behind the real, really why they're doing this. And the one thing I want to make sure is everybody understands it's not because of anything anyone's doing wrong. That's interesting. Nobody is saying there's fault to be laid at the doorsteps of these folks that are up here. In fact, we're hearing just the opposite. A lot of accolades, a lot of awards for the work that they're doing, a lot of the connectivity that we're seeing. in county government in supportive services that we're getting from these folks. So no one is complaining. No one is saying something has happened and is wrong. And no one's really asking for this change, not even the legislature, the public. So what is really driving this is what really is concern to me. And I got to be honest with you. Something doesn't smell right because I'm not getting a lot of answers. We're not getting true direction. And there's no motivation to make this happen. So Drew, I wanted to hand it off to you. I apologize. I got more into my bully pulpit here, but you may have a little more legal response than what I just had.
No problem at all. I'm Drew Vandegrift. It's my privilege to work in Macomb County Corporation Council and to represent MCCMH. I had an opportunity, Senator, just to confirm that quotation is one of several verbatim excerpts from the Mental Health Code that more both the funding and the service delivery at the county level. So it's one of many laws that say something similar to that.
Go ahead, Mohammed.
Thank you so much for having me. And as the sole federal representative here, I love Jen, so I hope everything's okay.
Me too.
But I'd like to echo what the county executive had said. I didn't write HR 1 that recently passed, but I'm here as a listener and someone that I can communicate directly to the Congresswoman, who is also the chair of the House Republican Conference, who has a seat at the leadership table. But what I have written down with regards specifically to Medicaid is obviously the priority was to protect from what you had said, burdens onto the system, the waste, the fraud, and the abuse, which I'm not going to echo again. But this bill does all of that while still protecting pregnant women, children, seniors. All we're asking is for able-bodied people without dependents to work or volunteer or search for work a minimum of 20 hours a week. That's all that the bill does with regard to Medicaid. I'm not sure where the conversation, had been had with regard to Medicaid. And this might be a question also. Do you have any insight specifically, and it may be something I'm not even aware of, where these Medicaid cuts specifically founded from HR 1 are being felt right now, or you're anticipating on being felt rather than just MDHHS's directive coming from this?
I cannot respond to that specifically. Richard might be able to, but there's no cut immediately. We know that it didn't go into. I mean, it's approved, but it didn't start happening yet.
But if this directive came from MDHHS and the county executive and a number of you all asked for, where these specifically came from, these privatization efforts, I'd like to know if it's specifically something HR 1 related, because if it is, I'd like to get back with you all on that.
Yeah. So again, we're not feeling any immediate, just to be clear, we're not feeling any immediate financial impact to the system today, nor do we expect to see any immediate impact to the system in 2026. There will be a rollout in terms of, again, we have in many venues with the Michigan Department of Health and Human Services. I sit on quite a few, both operational and financial work groups with them, ask the question about, can you please point us to whether it's in a federal law, a federal regulation, a state law, or some sort of state regulation where the privatization becomes mandatory or somehow becomes a requirement of the department. And we've not been able to see anything yet. And that's where we continue to push for, help us understand why. Not only because as the State Department, you kind of owe us the why, but so that we can then turn around and we can explain that to our people that we serve why, because they deserve that answer.
And I just want to add to that because, and somebody mentioned it, but the state's been measuring our performance forever. There are these, performance indicators that they look at and how we do on things. And so we've been doing really quite well. In fact, so well that we get, it's performance-based incentive funding, PBIP dollars they're called. And so if we were doing bad, we wouldn't be getting all that money. So clearly we're doing a good job. And I do remember when I testified in front of Mike Shirkey a couple of years back, Dan Lowers was there. But anyways, one of the things I pointed out were the HEDIS measures, which is the scoring system for the Medicaid private health plans. And I shared how badly they have done. And so I don't know. And still it's the same thing. We're doing a good job. So tell us what we're not doing. And if you really look at Blue Cross or some of the other entities, McLaren is a nonprofit. That's another potential bidder, I would say. There's a lot of issues with them, and I'm trying to look for their current HEDIS measures, because that was a number of years ago when I did that review. But anyways, so we don't think it's performance based, so we're not really sure. And the other thing that's so odd is it just keeps coming up. It's super odd this time that it came up under Democratic leadership in our state, because usually privatization has been more of a Republican issue, and I don't want to get into that either, because in my opinion, mental health should be nonpartisan, period. And so there shouldn't be the issue, but so I don't know, that's enough said about that, I think. But so the Medicaid funding cuts, we just know there'll be cuts. We're not talking from the federal level. I mean, there'll be those too, but we're talking about at the state level. If they get a different manager, they have higher administrative costs, that will result in a reduction. And most of us rely heavily on the Medicaid. It's about 90% of our budget.
Yes. Can I just respond to a couple of the questions real quick? On HR 1, the work requirement is the least of my concerns, quite frankly, because it excludes children and it excludes people over 65. The reality is the so-called able-bodied, over 70% of them are already working 20 hours, 40 hours, 60 hours a week. That's number one. And the problem I have with HR 1 is not that sorry about that.
I love that.
I put this.
It's relaxing.
I put that darn thing on silence and didn't do any good. It's
all right.
Is the requirement that you recertify twice a year. And not only do you have to recertify twice a year, and anybody who's gone through the Medicaid process knows how cumbersome and bureaucratic that is, and you're going to have additional staff to process them. Sometimes it takes more than 6 months to get certified. That's the bigger problem. And under the work requirement provision, HR 1 requires that if you're in the exempt classification, that is, if you're a child or you're over 65, you have to recertify that, prove that you're exempt twice a year as well. That's a problem because people are going to fall through the cracks, number one. And number two, if you're 80 years old and in a nursing home, you're probably not going to be under 65 6 months from now. I don't think we have to worry about that. Right. Everybody agrees we should get rid of waste, fraud, and abuse. Fraud should be referred over to the Department of Justice so we can get some of that money back. That hasn't happened. In terms of Veronica's question, and I agree with you, if CMS is saying we have to do this, it's not in law. We know that because we've checked it. It's not in rules or regulations. We know that. We've checked it. So the suggestion is that CMS, who has to approve our plan, has told the department this. We FOIA'd that information from CMS. Said, show us where CMS has told you that you have to do this procurement process or that you're not going to continue the exemption we've had in dealing with the public system. They won't respond to that FOIA request, just like they won't respond to the other one. If somebody won't send me the proof for what they're telling me, because I don't think it was a phone call, only I suspect it was an email. If it exists, if they won't send me a copy of that email under a FOIA request, I begin to question whether or not there really is one.
Just really quick, I don't want to debate what's happened at the federal level regarding that, because we're here about the bid out is what the main discussion needs to be, correct?
Right, but the last point that he made, though, I think is important, because if Mohammed could find out for us, is there a requirement from at the federal level that is making MDHS do this? That's important. If you could find that out, that'd be fantastic. Other questions?
Yes, I'm just going to make a comment on that. So back to your number 7, that was in the budget. That is a boilerplate. Yep. And then, okay, so I sit on the oversight committee for public health and food security. And we have the wrong person in the room if these questions are, which is disappointing that you FOIA'd a department and have gotten no answers. This is, you guys don't get mad at me, but this is governor driven. This is her department because, and I'm looking at my notes. So this policy is driven by the department's goal to address identified issues in the current 10 region PIHP structure, including fragmentation. These are things they keep telling us, which service inconsistency and limited accountability as informed by over 2,600 survey responses from Medicaid beneficiaries. You talked to address that. Advocacy groups and other stakeholders collected earlier in 2025. So this is a department goal. This is not driven by the legislature. It's not, as far as I know, because the RH1 whatever came out just recently. So that's separate. This is something we need to talk to the executive branch about and say what is going on, and get Ms. Hertel in and ask her what is she doing, what is she trying to accomplish? Because I think all of us here would agree we love our community mental health. They all have their unique flavor. I mean, I have 3 counties which all are here, which is wonderful, and all 3 of you have very different unique goals, a different community, different people, and it's great that how you address the community individually. So I know personally, me, I would never want to get rid of that, and I'm confident my colleagues are with us, and it is in the state law. And so if they don't, though, comply, I know Executive Hackle doesn't want to pursue it, but we may have to take legal action, and they're breaking the law. And this is not being driven by, well, thanks, by the legislature. So when I was confused what this was, because you should go back and watch some of our oversight committees. I mean, it's like watching paint dry, but we've talked about this a lot, and I never quite understood what was going on. And today kind of put it all together, how it impacts the communities directly, but this is a department driven. So I'm speaking with Jamie Green Authority from my committee, but I would say this is only coming from the department, and the governor may or may not know.
We know that it's only coming from, we know that it wasn't legislatively driven, but we wanted legislators here because we thought if anybody could stop it, you folks could, because there's a lot of things that have changes that need to be made in legislation for this to occur, and laws need to be changed. We talked about all those things. And I do remember the first round of this, when they tried to do the all-out competitive bid. There were 2, Senator Hammerstrom and Johnson, were they both senators? They won our Go to Bat award that year from our state association because those 2 women legislators were able to stop the all-out competitive bid process. And that time, what they called their initiative, once they couldn't do the full out, was an application for participation because what, see, Dana, she remembers, because what they said is if DCH, whatever they were at the time, they were trying to say that we weren't qualified. So then the senator said, okay, then issue an application for participation. And if the people in the system are qualified and can do this, they need to get the contracts. If not, we can talk or whatever. And so that's what happened. And I remember that's before all the technology. And our associate director at the time drove like 6 binders, boxes, and ran them up to MDHHS for the review. But this has been going on for years. I didn't request it. Our state association, Bob Sheehan, Alan Bolter, they did the FOIA request. I don't know the date, but they've talked about it. Yeah, we can find it out. It's been a while. Yeah, it's been a while though. I do know that. So we do think, and I have written 3 separate different letters to Governor Whitmer about this. And I know a lot of my colleagues have written letters to her as well. So if she doesn't know about it, I don't know how she doesn't know. But I do agree it's driven by the department. Anybody want to add to that? Other questions?
You're 100% right. We can sit here and debate all these other, whatever happened at the federal level, whatever, and have Tom go ahead and check whatever he wants to do. But the reality is we're not getting an answer. That's all we're asking for. In other words, it's driven by the FDHHS. The governor is fully aware of what's happening. I already know this. But we're not getting an understanding as to why are we doing this. And it's not, and what we're worried about is that you're all going to hear all these other parts of the conversation that are going to confuse you. They're not good enough. They're not doing the work. We have a problem, which is absolutely not true. Or that we're being forced to do this on the federal level. That is absolutely not true. And every time we try to ask for something to show us where it's coming from, a mandate from the federal government, whatever, not a word. We don't hear anything, even with the FOIA request. That's the reason why we've already kind of pre-wrote the actual litigation on this, because we know something's not right. We're not, I don't give a darn about the R and the D issue here. I want to know something that's going to have an impact on what we're doing with being in Macomb County that has been going incredibly well for so long. We've got a lot of great things transformative on the horizon working with these folks, and something just came about that nobody has an understanding as to why is it coming about. And so we're hoping the legislature can start peeking through the windows and start asking questions. Even though it's a governor-run department, if the questions start coming from the legislature, there's going to be a little bit more skittishness happening as to whether or not they're really going to want to do this. And I'd rather they put a hold on this than we having to litigate this issue. I've been working in a jail cell for many years. I don't need to worry about a microphone.
That's easy. So with that being said, we're just asking for the question to be asked on behalf of the legislature. Why? Why is this happening? And if you're being given answers that you just don't know are true, please check with these people, because they're going to give you the real story as to whether or not there's validity to the comments that they're making.
Well, we have
So
oversight tomorrow, and for the good of the order, make a comment.
Appreciate it.
So that was one of, like, the legislative ask is, I mean, I'll give you, I thought we had the bullets on the slide, but we don't, but it is to oppose any MDHH efforts that permit or support the PHP procurement process without formal legislative oversight or amendments to the mental health code. Our second ask is that you honor the legislative intent, that they honor the legislative intent. MDHHS must release full appropriated funding to the CMHs. That you support Medicaid preservation as much as possible. You protect the local voice, keep behavioral health governance in the hands of those who live and work in the communities that they serve. And then MDHHS to work with CMHs to fix, we agree that there's areas we could be more efficient and we can improve on. And in fact, they've been, every committee they make these days when there's a new initiative, it's CMH driven. Like they're trying to push out, and this is complicated maybe, but the CCBHC funding directly to us. And they're like, who wants to lead this committee? And it's a CMH person every single time. That's who's figuring out how to do this for the department, the current staff out in our system. And so we are more than happy to work with them. We've offered to, and especially to reduce the administrative burden. That's costly. There's so many ways we could be more efficient, and if they would let us. So, so that's what our ask is. You know, we also encourage you to, you know, if you have any questions to any of us, we're happy. We're going to stay after 2 and talk a little bit. Anybody wants to talk to us, you have our cards are available either at the desk or on us. If you want to give us a call. But I just think this is so incredibly important, and we need to stay on it. We need to stay vigilant.
Deb, before you close out, we have some questions as board members.
Oh, go ahead.
If this is federally mandated, what are other states doing? We can't just be affecting Michigan.
That's why we say it's not federally mandated, but that's what Muhammad can follow up with Lisa McLean, or we'll ask Jen Swift if she can ask Senator Peters' office to show the language. They've been saying that about, they're calling this conflict-free access and planning. They're saying that's mandated, but it's not done consistently across the country. So there's a lot of things like that. If it really is a federal issue, it should be consistent across the country, right? Not exact. Well, we do know, and actually I can't remember the states. Arkansas was one of them. There's about 5 or 6 other states that they did do what the state's trying to do here, and it dismantled. There were 7. You want to answer this one? Because I don't remember the facts, but there's like 7 states that they did it, and they dismantled their public system, and it was a mess, and then they had to try to pull it back together. So I don't know, and we can get you that information too. I had it in one pile of my notes, but we were trying to eliminate some stuff.
A really important question. Michigan's unusual, aren't they, because of our waiver? The other states don't have the setup that we have.
Well, some states have their own waivers, I'm sure. I don't know what they all are, but I've never studied that, so I don't know. But we do have a waiver for the state of Michigan, for sure. And we do some things differently than other states do it. And we have been in the shared risk arrangement with the department for, I don't know, 20 plus years. I don't know exactly the number of PHP years. Well, more than that, actually, probably. But at any rate, for the most part, there's been no problems with that. Somebody, question? Oh, go. Okay, go ahead.
So as a CMH board member
you.
and also a family member, a family member of someone who is in service, receiving services here through the county and through CMH, I think the elephant in the room that I'd like to address is that we're already seeing, I think, across all of society, a move towards these big, impersonal, gigantic corporations just taking over every aspect of society. And for me, this really comes down to, do we want a nameless, faceless corporation being in charge of something that affects us on the community level? One of the beauties, one of the reasons that I'm involved with CMH is the beauty of having these local communities that the police, the schools, the people who are participating in the jails, the services that my family member has received have been involved with SC4. Local communities, local involvement. I have not seen that with Blue Cross Blue Shield. I haven't seen that with Anthem. I haven't seen that with any of these big corporations. So I think the bigger issue for me is, where are we going as a society? Do we want to put everything in the hands of big corporations because they're not accountable? You can pick up the phone, you can call Deb, you can pick up the phone, you can call all of the people in your county and talk to them about this. You can make changes.
Yeah, I was going to say, when Will said
you
that,
can attend meetings. That's not going to happen if we have Blue Cross Blue Shield or anybody else in charge. This is privatized.
you're right. When Will said about his cell phone, I bet you every one of us, I have the police have my cell phone numbers. I have theirs, prosecuting attorney, hospital CEOs, all kinds of things. And so when there's an issue, somebody calls me, doesn't matter when, I don't have to go to work to find some phone number of a business. I have it, and we can connect. And so that has been one of the really good things. Go ahead, Dawn.
I had not heard throughout all of this, because it took us years to get a dual option plan going here in the state. And how will this affect the dual option plans that we have in the state? Does anybody know? Because I was curious, because my daughter she has a dual option plan. So I'm not quite sure how that would work. And real quick, when I saw the
We think there's changes to that too, but we are not.
only because I know
Right.
to have a dual option plan through Blue Cross makes my head spin.
Because you're talking about your daughter as Medicaid, Medicare, right?
Right.
Right,
Medicare
yeah.
and Medicaid.
Right,
to
and
do
that's even a more complex issue.
Yeah, and to do that through Blue Cross, I can't even wrap my head around how that would go.
And the only other thing I wanted to make another thing clear. I keep forgetting to say this point, but so when even Catherine was talking about having to contact a big corporation, there could be 3 of them for St. Clair County. There, like right now, there's one regional entity for our 4 counties, or in Macomb, one regional entity. That's who you call if there's a problem. But in the new world, you might have to go, oh, who are you? Wait, you get service from this one,
Yeah.
but Blue Cross is your payer, or who is your payer? We don't even know.
Exactly.
So that's going to be a problem.
Exactly. And when I was, just to reiterate how important CMH is, I had to utilize the services in Macomb County, not only for my daughter, who's developmentally impaired, but for myself through 2 inpatient psychiatric unit stays. And once here in St. Clair County. And in both counties worked with Medicaid. Without Medicaid, my daughter being able to live independently, for me to not have to worry about what's going to happen to my daughter when I'm not around scares me. It's sleepless.
So make sure that you do all of our call to actions
yes.
and all those things.
Well, and the thing is, it took a while for me to get a diagnosis and for me to get the correct medication. As it stands today, I am not only a board member for community mental health, I am a board member for St. Clair County ARC. I am also the mayor pro tem of the city of Algonac. Without getting the help that I needed through CMH and the medications that got me to this point, I wouldn't be sitting here. That's all I got to say about that.
So thank you for sharing all that. And we're gonna wrap up the formal part of this session, but we're gonna stick around here. And if there are any more questions, come up and ask us. Or if you don't have time today, you can give us calls, email, whatever. I'm better with a call. I'm happy to give out my cell phone number.